There we go. Okay, perfect. So welcome to all who are showing up live. This will be recorded and posted on our, hang on a sec, let me just move this out of the way here. On our YouTube channel, on the Clementine YouTube channel, for later viewing, but this is going to be a brief chat about hormonal health in your 40s. So I'm super excited about this and passionate because I feel like so many women come to me in their late 30s, early 40s and beyond, and just kind of don't really know what's going on in their body. They feel tired, they feel stressed out, they don't know what is happening to their hormones. Is it their hormones? We don't know. And so that's kind of what we're going to talk about today, embracing the change, and how we can really flow with our body instead of fighting against it, and understanding why we're feeling the way that we are feeling. So if this would just, there we go. So just a little snippet about me. I think most of you who are here know me, or are patients of the clinic. But my name is Dr. Alex Dragon. I'm a naturopathic doctor here at Clementine. I also have my own private practice out in Coquitlam. And I focus in women's health, digestive health, and I dabble in aesthetics. That's the fun part of my practice. But I really am passionate about helping women feel good in their bodies, whatever that looks like to them, because health really is subjective. So just a quick disclaimer before we get into the weeds. This is obviously not intended to be a medical presentation. It's for education only. So take with, everything with a grain of salt. Each of you who are listening are individuals and you have different needs. So please reach out to your care provider, whether that's a medical doctor, naturopathic doctor, in your jurisdiction, to ensure that you're getting the proper care and not just kind of taking what I'm saying and applying that to your own life. So let's get started. So what happens when you turn 40? This is a bit of a blanket statement. The changes are happening pretty much after 35 up until 60. So this gradual decline of estrogen and progesterone starts happening in your late reproductive years, which is pretty much after 35. So typically women won't start to experience the symptoms of perimenopause until they're in their 40s, but that is so variable, and that can really range from as little as 1 to 2 years to 10 years. So if you're experiencing sleep disturbance, irregular cycles, hot flashes, anxiety or mood swings, joint pain, muscle pain, brain fog, the list goes on and on. There's 30 plus symptoms of perimenopause. It could be that this is what's happening in your body, and it's good to explore that. There's lots of other reasons why you might be experiencing, some of these symptoms, but a lot of the women that I see don't think that they're in perimenopause because they have an idea that menopause happens when you're 60 and, when you're really old, and it's not the case when you're in your 40s. So the gist of it is that as your egg production slows and as you stop releasing as eggs every month, you have a decline in progesterone and then subsequently estrogen. So a lot of women, again, ask me, should we test my hormones? And I'm talking about sex hormones here because obviously you have your thyroid hormones, you have your stress hormones, insulin is also a hormone. So that's kind of a broad statement. But I think when people ask me, should I test my hormones, they mean estrogen, testosterone, or progesterone. And unfortunately, it doesn't really give us the answers that we want. So, which is not a bad thing. It's not as fruitful, if we test your estrogen and, oh, here it is, it's low. We know that it's low. It doesn't really work like that because we're constantly cycling. And yes, there's a progressive decline, but it's more like a roller coaster declining rather than like a straight, downfall. So we base most of treatment in terms of perimenopause and menopause on symptoms alone. Obviously, there's exceptions to that. There's exceptions to every rule. But there are other things that we can test. So it's important to look into the other aspects of your health because there's obviously many things that can be going on that aren't just related to perimenopause. So the basics in terms of hormones would be thyroid, cortisol, which is your stress hormone, and blood sugar. So many hormonal symptoms like hot flashes or sleep disturbances can also be potentially hypothyroidism or you have, insulin dysregulation, or your cortisol is, out of whack. So it's good to just rule those out. You can have things happening at the same time. You can be perimenopausal and hypothyroid, but that's why we like to take a holistic approach to your health. So thyroid hormone technically is T3 and T4. TSH comes from your brain, tells your thyroid to release thyroid hormone. And then TPO, which is, right below the thyroid hormones there, is antibodies. So oftentimes with shifts in hormones, especially during either pregnancy or perimenopausal, menopausal transition, there can be a triggering of autoimmunity. So a lot of times we pick up what's called Hashimoto's, an autoimmune thyroid condition, in this time frame. So it's good to just do a baseline test when you're in your 40s to kind of see where you're at. Insulin is the blood sugar hormone, which is commonly dysregulated and can also be contributing to that stubborn weight gain, especially in the midsection that a lot of women get in their 40s and beyond, as well as cortisol, which is your stress hormone, and that can also play a factor into stubborn weight gain. And then other tests, this is not an extensive list by any means, but this is kind of the basics: iron, B12, and vitamin D. Nobody feels good when they have low iron. If you're iron deficient, you just need to correct that. That's just a low-hanging fruit. If you're having sleep irregularities and you feel like crap during the day, check your iron, check your B12, check your vitamin D, because those are easy things that we can fix, and then you'll get, that much better on the next level. So first thing that we can do, obviously testing is helpful to understand the full picture, but reducing your risk factors. So in the menopause transition, and that's encompassing perimenopause up until you reach menopause, you do have an increase in your risk of cardiovascular disease, stroke, heart attacks. High cholesterol is another big one that creeps up on women. And that's because of the loss of hormones. You don't have that protection anymore. So men are predisposed to, cardiovascular disease, cancers, and things like that their whole life, because they don't have the protection of estrogen and progesterone. So this is something that I encourage all women to do in their 40s and 50s, is to reduce your risk factors as much as possible. So smoking is a big one. Any type of smoking, really, cannabis or cigarettes or nicotine. Try and stop that if you can. Reduce alcohol consumption. That's a tough one. A lot of ladies love their wine. And I get it. I'm a wine drinker, but it really messes with your sleep and can worsen the hot flashes. Address your stress, whatever way that is: journaling, walking in nature, doing breath work, whatever way you enjoy to reduce your stress or to add to your cup. That is really, really imperative in this transition. Sleep 7 to 9 hours if you can. Obviously, that can be difficult as well, especially with children around. And exercise 30 minutes, preferably weight training exercise. That would be the best for the menopause transition. And so you've done all of that and you're still experiencing symptoms. So what do we do now? So this is kind of my treatment approach simplified. So it's a four-part system. First, we need to correct those underlying deficiencies. So if you're iron deficient, if you don't have enough B12, vitamin D, zinc, whatever it may be, again, like I said, low-hanging fruit. Let's correct those deficiencies so you're feeling a little bit better. Balancing blood sugar is also imperative. A lot of women in that transition start to get unintended weight gain, and they can be more predisposed to diabetes or prediabetes. So we want to make sure we're getting that in check. And a lot of that can just be through lifestyle, exercise, nutrition, little tweaks here and there. Doesn't mean you have to go on a medication or a supplement or anything like that. Third is addressing your hormonal symptoms. So hot flashes, cycle irregularities. It's going to vary very greatly for a lot of women. Most people will get a little bit of hot flashes. That's the most common symptom. But what I see a lot is mood changes, so anxiety or, really irregular moods, and sleep issues. Those are another big thing in the transition period. And then treating comorbidities. That just means other things that you're struggling with. So whether it's high blood pressure, or high cholesterol, or hypothyroidism, making sure that we're keeping those in check as well as addressing the perimenopause. Oh, there we go. So just a little bit more in depth of what treatment looks like. So my approach is always from the ground up. So we work on the foundations of health, and that's your lifestyle, your nutrition, sleep, stress. Those are going to be your biggest tools because they're the things that you do on day to day, right? So having increasing exercise if you're not exercising, stress coping strategies, reducing the amount that's on your plate if you can, not adding more to necessarily feel better. Sometimes we need to do less in order to feel better. Nutritional changes, like I said, tweaking things, increasing protein, increasing fiber, making sure your digestion is flowing properly. Hormone therapy, I'll have a little snippet on hormone therapy in the next slide, but that can be very, very useful for a lot of women and safe as well. Nutraceuticals, that would be to address the underlying deficiencies. So if you're iron deficient, you can either take iron supplements, get an iron infusion, whatever it may be, B12, vitamin D, etc., and then managing your comorbid condition. So that sometimes does require medication. Sometimes it can be, within the lifestyle or nutritional categories that we can help you reduce your blood pressure. There's so many different ways that we can treat all of the symptoms that you're experiencing. And I have my little asterisks at the bottom there. Treatment is always individual. So remember that it's not going to be the same if you and your girlfriend are experiencing the same symptoms even. There's different, risk factors, there's different history. And so the treatment is always going to be individual, which is the beauty of naturopathic medicine. So a little note on hormone therapy. Many women fear hormone therapy. I see this a lot and think that it causes cancer. And of course, there's risks associated with taking anything, whether it's even iron. There's risks associated with iron and vitamin D. Too much vitamin D is not a good thing. So hormone therapy can be so safe for so many women, and there's obviously exceptions to that. But it's important that if you are experiencing those symptoms, you come in with an open mind, because hormone therapy, one, is bioidentical, which is what I use. Obviously, there are synthetic forms, but bioidentical means it's the same as your body. So the same molecule that your body produces. And the other thing that's really important is the route of administration. So oral, hormones, you think about the oral contraceptive pill, the pill is taken orally, and there's a lot of side effects associated with that. But when we use topical, a topical gel or a vaginal route, it's a much less risk associated with those route of administration. So that all that to say, it's important that you talk to your provider and understand your individual risk, because it's not the same for everyone. And no, it doesn't cause cancer. Obviously, there are risks of that, especially if there's a family history. But for the average woman who doesn't have that in their history, it can be incredibly safe and so, so helpful for many of the symptoms of perimenopause. So yeah, like I said, how can it help? It improves sleep quality, reduces hot flashes, improves mood, increases vaginal lubrication, reduces risk of osteoporosis, et cetera, et cetera. So there's a lot of positives to hormone therapy. And when I say hormone therapy, I'm talking about progesterone and estrogen. You don't always need both. Sometimes you can do the job with just the progesterone, but sometimes you do need a combo of both. So just to summarize here, I think I whipped through this, but I want to get you guys back to work and off your lunch break. Hormones naturally decline with age. So starting in your mid-30s and 40s, you start to have that natural decline of progesterone and then estrogen, which is more like a little roller coaster rather than just a straight decline. Testing your sex hormones doesn't usually help us assess for perimenopause, but your symptoms will help guide us. Treatment is going to vary, obviously, woman to woman. It's very individual, and sometimes you need just lifestyle changes, and sometimes you need medication. So it's going to vary. And hormone therapy is very effective, can be very safe for many, many women. But the caveat is obviously to discuss with your provider and make sure that you have that trust within your relationship with your provider and understanding how it can help you and what your risk profile is for hormone therapy. Okay, and then just a quick little parting note. I see many women navigating the hormonal changes of life, from puberty all the way into post-menopause. And all I can say is that your experience as a woman is very unique to you, and everybody experiences that transition differently. And so I can't emphasize enough that if you are experiencing uncomfortable or uneasy symptoms, there's usually a way to support you. And if you're not getting that support through whatever avenue of care you're exploring, I would switch providers and find someone that is on your side and find a team that's going to work with you to make you feel well, because life is too short to feel unwell. And a lot of these symptoms can be treated and make the transition way less rough and rocky and a little bit more ease, ease heavy, maneuver them with ease. So that is my short and sweet presentation for you all. Let me just check if there are any questions or if anyone just wants to unmute themselves. Hang on a sec here. Let me just check the chat. I don't think there was anything. I think that was it. Awesome. Okay. Well, I hope that everyone enjoyed. Let me just share the screen again here. This presentation. If you do have any questions going forward, you can feel free to email the clinic, hello@Clementine Clinic, and address it to me. I'm happy to chat or field any questions that you may have. I know it's kind of hard when you're bombarded with a bunch of information. But yeah, I really enjoyed. Oh, there's one little something popping into the chat here. Oh, you're welcome. Wonderful. Okay. Well, I will sign off here, and I hope that you all enjoyed. Have a wonderful rest of your day.